Hi, Dr. Mark here for Natural Health. Hope you're having a great day. We're going to talk about the nervous system tonight. October is Chiropractic Health Month, Appreciation Month, and we've celebrated the 125th anniversary of chiropractic on September 18th. So we've been around a while. This office has been around for 38 years already, so had quite a bit of an experience here. We always done chiropractic, of course. We're based as a chiropractic office, which not only means we do chiropractic for pain and for insurance, but we do chiropractic and the philosophy that goes along with it to help the body actually heal. Chiropractic is a healing philosophy, so it's different from the allopathic medicine, where allopathic medicine is more geared towards treating symptoms. Chiropractic philosophy is geared towards treating causes. And so a little different idea here. And of course, when you add nutrition to it and energy coaching, you're looking at all the different phases of how to heal the body. And again, not only physically, but mentally, spiritually, all these things that help to get energy up. We're going to talk about energy today as I get into what I'm going to talk about. So we'll start talking about the nervous system. And so many people know about the nerves. And about all they know about the nerves is that these nerves come from the brain somehow and make you move, and they make you hurt. So that's part of the system of the nervous system is the peripheral nerves that look at movement and pain and the sensations like heat and those kind of things. But there's a lot going on in the autonomic nervous system. Now, that's the system that has to do with control of the organs. And so people a lot of times don't even think about that system. They just kind of hope that everything works out okay. And as we're in our present situation with this virus business, it's not working out so good for many people. So in our office, we're looking at trying to educate patients on how the autonomic nervous system is working or not working, and why the body doesn't heal correctly. A really good simile of this is if you get a cut on your arm, usually in 10 days, 2 weeks or so, that usually heals up pretty good. So then why doesn't your body heal up if you have an assault on the body? Why do people have high blood pressure? Why do people have diabetes? Why do people have heart disease? If the body's able to heal that up, it has the innate ability to do that, the intelligence to do that, but why isn't it able to do that? So that's what we're looking at the autonomic nervous system. That's the system that has to deal with that. And so, as you can see from this chart, these nerves that come from the spine also go to all these organs, all the organs and glands of the body. So directly or indirectly, the nervous system controls every cell or influences every cell in our body. So of course, it's a major system, and a lot of people don't even realize really what it's doing in there. We've learned that the sympathetic nervous system, a part of the autonomic nervous system, is in the skin. That's part of what you feel sensation-wise, sort of. And there's enough of those nerves in the skin that if you removed everything else, just left the sympathetic nerves, you'd be able to recognize a person. So a lot of nerves in the body that we're not really taking into consideration when we look at the nerves of the body. We're thinking that chiropractic, for instance, only works on the nerves that have to do with pain. But chiropractic adjustment and getting the normal nerve flow of the body works on everything in the body. That's how we can help the body to heal everything in the body. When chiropractic first started, they worked on all kind of disease processes. The only problem with chiropractic over the years, we got into the insurance game, and insurance diagnoses are only for pain, so that's why people think chiropractic only works on pain. Well, that's not near the case. And so that's what we see in our office is all kind of problems, from acne to whatever, just anything we work on here, because we're helping the whole body, not just pain. We do very well on pain, but we're also working on all the other systems of the body. So we'll go into the heart rate variability exam that we do in our office. Now, Dr. Chip talked about that last week when we were looking at some of the things we do, but I wanted to bring it up again today because we're looking at, with the heart rate variability unit, we're looking at the autonomic nervous system. And the system, again, has to do more with control of the automatic systems of the body, like breathing and heart rate, digestive system, liver function, kidney working, all these things that we don't even know about that the body just does automatically. That's what the autonomic nervous system takes care of. Now, it is broken into two systems, the parasympathetic system and the sympathetic system. The sympathetic system is your fight or flight system, has to do with energy of the body. When you wake up in the morning, that system kicks up, you have energy throughout the day, and that's where your stress hits that system, the sympathetic system. The parasympathetic system is your rest and relax and rebuild system. At nighttime, the parasympathetic system is coming up, and it works more at night to heal the body. So what is the problem with most people in our society right now, especially in the last 3 or 4, 6 months, 8 months, whatever it is? We're stuck in the sympathetic nervous system. The sympathetic nervous system is tuned up, it's cranked up because of all the stress we're under. And people that are reacting to this emotionally have a sympathetic system that is way overactive. And so their body's in a cortisol reaction that's reacting to stress. This is hard on the immune system. It actually lowers the immune system because like again, Dr. Chips talked about. If you're running from a tiger, your immune system's not going to be working that much at that time. So parasympathetic is more that system, the rebuild, relax system. And what happens at nighttime? We're not getting good sleep. Especially if you watch the news at 10 o'clock, don't ever do that because then you're not getting good deep sleep. You're not repairing. You're not rebuilding the body. Also, if people are eating a lot of comfort foods, we're seeing that in the office now. People are eating a lot of comfort foods, which again is more junk. And you're not getting the good nutrients. So reacting to this COVID business emotionally has caused a lot more problems than the even virus is causing. They're seeing a lot of problems with the psychology of people, the physiology of people coming from the stress, and this is causing more problems than the actual virus itself. So pretty interesting stuff. So what we're doing with our heart rate variability exam is trying to balance the parasympathetic and sympathetic nervous systems. We're trying to actually get these two systems to work correctly so the body can heal itself from the inside out. Again, the allopathic medicine, they do a great job with what they're doing, but they're trying to heal the body from the outside. They're trying to use techniques or surgery or medications to heal it from the outside. We want the body to do all this from the inside, using the nutrients it needs from the inside. And again, the biggest problem we have on the nutrition side here, that's what I deal with a lot, is people don't digest. They don't absorb and digest things. Most people have some type of irritable bowel or leaky gut syndrome going on because of the foods they eat, and they're not absorbing or not digesting the good proteins and fats. They have a lot to do with the body healing itself. This is all, again, back to this autonomic nervous system. If the body's into a sympathetic phase, it's under fight or flight, your digestion doesn't work. I don't care if you sit down to eat, it only take 10 minutes to do it, slide it down real quick and go back to work. That system's not going to absorb what your body needs. People have this problem that they think that just whatever you stick in your mouth is supposed to go where it's going to go. That's absolutely not true. Things don't work like that. The body will not be able to absorb and use those foods. That's what we have in our program with nutrition response testing, is figuring out how we get the body to detox, get digestion back on track, get this bowel to work correctly, so you can absorb foods, not only the foods you normally eat, but the supplements that we use for people to get them to utilize it correctly, be very efficient with whatever nutrition you're taking. Another problem I see with a lot of people out there are going to different places and buying nutrition, buying supplements, and then they don't get any relief from it, they don't get any help from it, because you're not absorbing it, even if it's to the right source, and many of them are the wrong source. But anyway, that's a whole other topic. I'm going to go into this little graph here. This is one of the graphs that looks similar to one of the printouts that comes off the heart rate variability graph. And what it graphs is, I don't think it's written here, is the functional capacity, which basically means that's how the energy of the organs and glands work. And then this side is the adaptability, or that is how much reserve energy your body has to handle stress. The adaptability, the body's ability to adapt to stress in the environment. Functional capacity, again, is the energy that the body has for the organ systems to work. And so what this tells us, when we get a patient that gets a number here, this patient has a 4.3. A healthy 50-year-old is right in the middle at 7.4. So this gives us a way of kind of determining physiological age. And we can then get an idea what we need to do with another part of the graph that actually measures the parasympathetic system and the sympathetic system and see what kind of balance that is in. And if many people are in sympathetic overload and parasympathetic parasympathetic's not working correctly, not working enough. So we have to balance that out. And usually it has to do with minerals and B vitamins. And people are burnt out, don't have enough of those. So we have to work with that a lot. But again, we have to first start by getting detox to work, get the body cleaned out so that the body can actually absorb these nutrients or utilize them, and then get the digestive system to absorb the nutrients as we go into that. So it gives you a little more explanation of the nervous system and how we look at it, not only from the systems that control, peripheral nerves that control movement and pain, but also the autonomic nervous system that works on all the organs and glands of the body. It helps control all of these. So again, the nervous system is so important because it controls indirectly or directly all the cells of the body. I also wanted to quickly mention here too that we're doing this on Instagram and Facebook right now. This will be on Brighteon.com. And Brighteon.com, I want you to think about that one, because Brighteon.com is a non-censored source. We're also going to be on YouTube channel, but of course there's some issues with that. We've had some of ours taken off. So it's just a thing where we want to get this good information out to people. And I think one of the things we're seeing with this COVID business is a lot more people paying more attention to this. And also, we're also seeing that many people realize now that the allopathic medical system, the mainstream medical system, they do a great job on emergency care, injuries and things like that, but they're not doing very well with getting the body healthy, keeping the body healthy. There's too many influences there from the pharmaceutical industry, big tech, all that kind of stuff, and people aren't healthy. Again, half the population is obese, third is diabetic. There's different numbers for that, but a lot of people are in bad shape, and that's why people are having so much problem with this virus thing. We want to get that to change. People should not be obese. People should not be diabetic. Heart disease is still the #1 killer. Nobody even hears about that anymore. Cancer is still going on. Cancer is an immune system problem. So we have a lot of problems out there. So anyway, we're here to help with natural health, get people actually healthy. We have to look at it as more of a systemic or holistic approach rather than just treating and chasing symptoms all the time. So hopefully that gives you good information. And I think Dr. Chip is up here next. He's going to talk some more things about more chiropractic stuff. Have a good rest of the day, and Dr. Chip's up. Here we go.
Yay. Okay. So I'm Dr. Chip. I will be talking about the nervous system. Now, this might be a little repetitive because Dr. Mark hit a lot of good little points there, so sorry if it is a little repetitive, but as you heard before, Dr. Eddie saying more about the subconscious mind, and this will help with the subconscious mind, getting more of these different little topics into that mind much better. So again, the nervous system controls and coordinates indirectly or directly all the other systems of the body. So like Dr. Mark explained, that's digestion, that's breathing, that's our circulation, that's all the different systems of our body. And so we need to make sure that we can actually have a well-balanced nervous system that'll help us to have more health, have more energy, have more vitality. And so when we have everything well balanced, our spine is well balanced, everything like that, we're able to have a good nerve flow to those different organs and all those different cells of the body. Now, what Dr. Mark explained too is that the autonomic nervous system, again, it's the system that we do not have any conscious control over. So more that it's the things that we don't think about. It's, again, that digestion, that breathing, that circulation. So would it make sense to where if you're not being able to control the nervous system, again, the central nervous system being your brain and spinal cord, that the other parts of your body could kind of go haywire or have illness? And so if your brain is in constant, like Dr. Mark said, the fight or flight mode, the sympathetic dominant mode, it's going too much into overdrive, that we're actually depleting our energy from our body, from the different areas or the different organs that we need energy for, and that causes illness. So just like all the illnesses or diseases out there, we have been more kind of conditioned or think about that we need something so much, but we forget how powerful our minds and bodies are. So our brain, again, our nervous system, it's very powerful. Just like the cut on our hand, nobody really knows how that cut gets healed. We don't have all the scientific evidence and everything to know exactly what's going on. But you would say is that our bodies are capable of doing that. Our bodies are capable of self-healing and self-regulating. So we need to keep that in the back of our minds to make sure that it's not that we typically or necessarily need something outside, but what is going inside of us, especially our minds and our brains and our nervous system, that can help us to repair and regulate ourselves. So again, like I said, proper nerve flow to the organs and glands. Now, I'm going to pull the spine here, and like Dr. Mark had earlier, go ahead and go back to that. You can see is that that's kind of the similar model there, but our spine has all these different nerves going out of it, and especially at the top of it is our brain. So we need to make sure that we're having proper nerve flow to all those different organs and glands you can see there, so that they actually are able to self-heal, self-regulate. And when they're able to regulate efficiently, then we have very good immune systems. We have good digestion. We have good circulation. We have good respiratory, breathing. All these different systems are able to function well. And it starts really with the nervous system. And if we can have good nerve flow, then we're able to, again, have good, healthy organs. So again, like I said before, we've been kind of thought more, or kind of conditioned, or kind of thought more of that we always need something outside of us, that we can't really help ourselves when it comes to health and healing. But really is that our bodies are always self-healing and self-regulating. It's happening every second of every day. If that wasn't happening, then the germ theory would be correct and we would all be not really here anymore. So the body is very powerful in the sense that we got to make sure that we're taking care of our bodies and really taking care of our minds, so we're not putting so much stress on our nervous systems. Because when our nervous system is very well balanced, then we have a good balanced body. Again, our organs, our glands, all the muscles and tissues, all the different cells of our body. So when we have good balance and good coherence, if our minds and our brains are very well connected and coordinating with our bodies well, then again, that's a balance. That means health. But when we're unbalanced, that means that we can have issues. And when we're unbalanced, we can't heal. So when we, again, are unbalanced, we deplete our energy reserves, and so that creates an illness. Again, there's two different ways to look at it. We can either think that we are victims of our lives, or we can think that we can't do anything about it, that we always need this or that. Or how about thinking more that we actually do have a lot of control of our lives and what we do to put in our bodies, such as good food, good water, how we move our bodies, but especially, again, the different stress of the thoughts and emotions playing in a factor too. So again, if we're controlling how our nervous systems are working, if we're not being overly stressed, if we're taking time throughout the day to be mindful of what we're doing, if we're resting and relaxing properly, if we're getting enough sleep, then our bodies can self-heal, self-regulate. And so that's kind of more of the whole premise of really how chiropractic was kind of born or birthed there, and how, again, it used to help a lot of different cases because it balanced out the nervous system, again, our control, or we would say like the CAO of our bodies. And so that's kind of how chiropractic came about to be. Now we've kind of went back and forth a little bit, but really that's the fundamental thing of chiropractic. So I think that is it for there. Upcoming health shop is again next week on pain and inflammation. Thanks again for always watching these health shops. We always really want to help you know more information, help you have a good understanding or a better understanding of how healing and health works. Again, you can always follow us on Instagram and Facebook at Natural Health Quincy IL, Natural Health Quincy at YouTube and Brighteon. You can, again, love us or like us. The number is 217-228-2040. And we're located at 2000 Jefferson Street, Quincy, Illinois, 62301. Thanks for watching, and have a good